Last year, in 2024, I declared that Big Idea platform, BID, stands for bold, innovative, and pioneering. What was interesting is that one of our speakers, if you all remember, Toyosi Akerele Ogusiji, spoke on her big idea to leverage AI to create the future and the new matrix for Africa. Less than 12 months later, the first AI African movie was launched on April 18th, 2025. It's Africa's first feature film on artificial intelligence. It's made with love for Nigeria and Africa, made by and for Africa's successor generation. It is made to show the world, and I love this line, it is made to show the world that people who make it in life don't have two heads. This movie, and I was at the launch, is a landmark, disruptive, foundational, future-shifting movie. And part of the idea was birthed and announced at the Big Idea in 2024. So what Big Ideas platform has been established to do is to announce the new, and the new that is disruptive, that is pioneering, and that is bold. This year, we're focusing on brain health and mental well-being. And as many of us know, this is a major subject matter gaining significant global attendance and attention. As awareness of mental well-being grows, its profound impact on individuals, on communities, and on future generations becomes increasingly evident. If you have a family member that suffers from mental health, you know how limiting and constraining that it can be on their lives. And when it is not taken care of, it has impact on productivity, and not just the family, but the nation at large. So this year at BIP 2025, we're examining how our brain health influences our mental well-being, influences every decision we make, whether in policy spheres, personal interactions, or everyday choices, like what to eat and how to communicate. More importantly, it shapes our ability to respond to trauma and determines whether we break our cycles of suffering or we perpetuate it. There's enough data that shows, and School of Politics, Policy and Governance, we are big on data. The World Health Organization in 2022 showed that 1 in 3 people develop a neurological disorder. 1 in 3 is significant. It's almost like a pandemic at some point in their lives. And I want to pause to say that I remember the first quarter of last year, I dragged myself to a spa resort for 4 days. I went there for 2 days. After 2 days, I hadn't recovered. My mental well-being was so messed up. So it's not something that happens to other people. It can happen to any of us in this room if we don't protect our mental well-being and make sure that we are not burnt out. Unfortunately, as I'm applying it to myself, unfortunately, it shows that the low and middle income countries in sub-Saharan Africa, they bear the most significant burden, accounting for 70% of brain disease and disorders globally. That's serious. When I saw this data, I thought that our government is definitely not paying enough attention to this matter, and that's why I'm excited about this year's Big Ideas, because I think it's going to open our world, our thinking, our mindset to what we need to pay attention to and what we need to do to make sure that this global pandemic is contained. And why is this important? Because the consequences of poor brain health extends beyond the individual. They affect national economies, and human capital. The WHO position paper suggests that 43% of children under the age of 5 in low and middle income countries fail to reach their full cognitive development potential due to extreme poverty. And what this means, I have a theory, a thought, and I know many share it, that perhaps why we don't do too well in our WAEC exams is because some of our students already suffer from reduced cognitive ability. So what has been seeded in the first 5 to 10 years is what we now see manifest when they become teenagers, sitting for exams that is going to determine their future, and they don't do well. Why? Because they don't even understand the questions they're reading, let alone have the capacity and the ability to answer them. So what we're doing here this morning is critical to the future of Nigeria. We need to decide what can be done to support children and young adults who have already experienced delayed brain development due to socioeconomic challenges. This is serious. How do we address the growing prevalence of stress-related disorders in adults, as well as cognitive decline and dementia in the elderly? At the Big Ideas Platform 2025, and I'm speaking to many of the speakers, I've spoken to them, I'm excited about what they're going to say to us this morning. We provide space for innovators in mental well-being to present their transformative ideas, like Toyosi presented her AI transformative idea last year, to highlight the remarkable work, what many of them have been doing, and the impact they've had, and to engage with policymakers. Decision makers are challenged to take action. Innovators are encouraged to collaborate, and citizens, we hope, will be inspired to launch initiatives that create ripple effects across the continent. The keynote conversation is going to be led by my friend and sister, Emma Sky. You're not my sister, yes. Our keynote speaker from the Yale International Leadership Center, who will focus on emotional intelligence in governance and policy making, and its importance for a flourishing life. Other speakers include our dear Anike Ade Treasure and the Chuba Chine Esekwesili, that we fondly call the Esekwesili twins. As I close, I'd like to thank the Thought Leadership Directorate of the Unconventional School of Politics, Policy and Governance for the hard work that they have put into bring us all here together. I think at this point they deserve a round of applause. Last year they put together a phenomenal morning, and I know that today, because of the extraordinary work they've done, is going to be equally phenomenal. And I'd like to really thank and salute my sister and friend, Dr. Amina Saliu, for leading this phenomenal team. And our rising able assistant. Well done, Awa. As I close, of course, I'm going to talk about SPPG. SPPG is a replicable design and a public leadership development program. We call it a laboratory where we are designing a program that will announce the next set, the next group, the next community of political leaders who have what we call our 3 C's: character, competence, and capacity. We train and support them into entry into politics and the public service, and they're a new generation of political and public leaders. Yesterday, we spent time launching the network, SPPG Network of Public Leaders. It's not the normal alumni association, but people who have passed through our 10-month program that is rigorous, that is curated to help every public leader step into position and know how to solve the problems that Africa faces. And note I said the word Africa, because we may have started with Nigeria, that's why you're in the room today. But we're in Senegal, and we graduated our first graduates in Senegal in February this year. And we've launched in Kenya, we've launched in Ghana. We are determined to raise the next generation of public leaders because we are declaring that enough is enough concerning the way our political ecosystem is governed. Bad governance. We are raising the people that are going to listen to the citizens and deliver good governance to them. Africa, without this new class of political leaders and public leaders, will not arise and take its rightful position in the polity of the global arena. And so what we're doing is critical. What we're doing this morning is equally critical. And I welcome you to sit back, relax, listen carefully, take your notes, and make sure that at the end of this morning, your mindset towards mental health and mental well-being is transformed, and it is revolutionized, and it is disrupted, and begin to do things in a new and different way. Thank you very much for listening. Have a great day.